Hello and welcome to the Multicultural Media Online Conference. Thank you very much again for joining us for all your health information to share with your communities. I'm your moderator, Jesusa, Helaratne, Deputy Director of the Multicultural Health Communication Service. And on behalf of the Ministry of Health and Multicultural New South Wales and our service, thank you very much for joining us today. We're very honored to have joining us this afternoon to answer your questions, none other than Chief Health Officer Dr. Kerry Chant, who's also the Deputy Secretary of Population and Public Health. Welcome, Dr. Chant.
Thank you.
And as always, we have our New South Wales Health Senior Medical Advisor, Dr. Jan Fizzell, joining us to answer some questions. Hi, Dr. Jan.
Hi, Jess.
I am not in studio today with Dr. Chant and Dr. Jan because I am a close contact. So I am to be safe, I've tested negative, but I'm a close contact, and so making sure that I'm staying away to keep my colleagues and community safe. We would like to begin by acknowledging the traditional owners of the land on where we are all meeting from today. We acknowledge the traditional custodians of this land from which we are all joining. I'm joining you from the land of the Darug people. We pay respect to elders past and present and extend the respect to Aboriginal elders and colleagues. We also would like to acknowledge the elders from all multicultural groups represented at this session today. Thank you very much for keeping your microphones on mute. Please ask your questions and comments on the chat, and we'll do our best to answer them today. Please share your thoughts with us as well on the chat because we want to have a lively discussion. My colleagues from the Multicultural Health Communication Service will be adding links on the chat for resources and information available in multiple languages and health initiatives on the New South Wales and New South Wales government websites. I'll pass it over to Dr. Chant for an update, and Dr. Jan, but we'll start with the questions now. We have changed the format for today as we have a few questions that we've received. Dr. Jant, one of the questions that we received is from Dr. Pradeep Kumar Darpan from Hindi Radio. What risks do we have because of highly infectious Omicron variant in China? Why have we taken off all the mandatory precautionary measures in a hurry?
Well, maybe I'll jump in there, Jess. So in terms of the Omicron variant, we're currently coming out of a wave that was driven by a type of the Omicron variant, BA4 and BA5. We now have a number of, we're at fairly reasonably low levels of transmission in the community, but we are expecting to see waves into the future. The exact timing, nature of that wave is unclear, but we are watching a number of different sets of data to inform us about that. Just because the orders have been with moving away from public health orders, it doesn't mean that people shouldn't do the right thing to keep their community safe. And I just want to acknowledge the amazing work of the multicultural communities in working together to keep their communities safe. And I would expect that those behaviours would be continuing. So those behaviours that Jess is exemplifying today is that she's a close contact and she actually has developed some symptoms. She's staying at home even though she's got a negative test, and she's going to get retested. We do want people that have got symptoms, cough, cold, flu, fever symptoms, to stay at home. And also we want them to not enter any high-risk settings in particular, such as aged care, hospitals, disability services, or have contact with vulnerable people. It is important that we act together to keep each other safe at this time.
Thank you so much, Dr. Chant. A question that we've been receiving from a lot of the communities is that there are changes to the isolation rules from October 14th. It's not mandatory to self-isolate if you test positive to COVID-19. What does that mean? I'll ask that to Dr. Chant and also Dr. Jan. What does it mean for communities as well? Dr. Chant?
So if you've got cough, cold or flu symptoms, we want you to stay at home. We want you to stay away from anyone, particularly if there's vulnerable people in your home. So keep to some extent, we're not mandating you under an order to isolate, but take those prudent steps to protect those, the people that you're living with who are going to be at highest risk of you infecting them. We're saying that you, wherever possible, please stay at home. If you have to go out to do grocery shopping or get, urgent supplies, please wear a mask at all times, and please go at the most times when it will be very non-crowded. Keep physically distanced. So whilst you're not under an order, we are urging you to stay at home and take those precautions, just as if you were to some extent under the previous settings. In terms of your workplace and your requirements, we are urging anyone that is working with high-risk vulnerable people to not continue to work whilst infectious. So as I said, the key message, first one, is if you have COVID, if you have symptoms, respiratory symptoms, stay at home. Generally, we would say you're infectious you can be infectious for up to 10 days. Obviously, you're most infectious a few days before you get symptoms, and then progressively get less infectious through that sort of subsequent 10-day period. But what we're saying is, most people, it would be 5 days, but in high-risk settings, such as if you're working in an aged care facility or in a hospital, your workplace will probably not want you to return to work for at least 7 days. And then there will be other requirements such as mask wearing and other protections in place as we try and work to protect the most vulnerable.
Thank you, Dr. Chant. Dr. Jan, you've been talking regularly with communities, doing regular sessions. What does this mean, and what is the sentiment that will be for the communities, and how should we start these conversations with our families and communities to continue to stay safe?
I think we'll see quite a different reaction between different sections of the community. I think we'll see some people in the community who are just feeling this great sense of relief that it's all over. And for those people, it's a hard message to hear that it might not yet be all over, that we still need to be careful and look after each other. And then there's the other part of the community that is really worried and scared still, because now they're worried that people with COVID may be out and about doing things. I think for the people who are sort of saying it's all over, stop talking to me, just gently reminding them that there are people who are still vulnerable to COVID, people who are immunosuppressed, people who are older, and they will still be concerned even if they're fully vaccinated. And I think for the people who are quite worried and scared, trying to start having that conversation about how did we react, 2 or 3 years ago if there was a flu season, or what advice we should be giving people into the future when we don't have that same sort of pressure of infection in the community. So thinking about, the things that we can do to protect ourselves, wearing a mask, thinking about what time we go out and about. Do we really want to be at this, major social event, or do I want to stay behind? How recently have I been vaccinated to, have that booster on board? Making sure that I keep listening to the health messages about when vaccines are appropriate, and making sure I just keep looking after myself and my mental health, because I think a lot of people, particularly those who are scared and who felt isolated over the last couple of years, may find that they're still feeling scared and isolated. So making sure that as a community, as we come back together, if we're seeing people who we're used to see missing, making sure we're reaching out to them and bringing them back into our fold so that they've still got that social network to provide support to them. Because I think there are a lot of people who've dropped back, who are feeling anxious about getting involved in community events again. And so by making sure that if we're seeing someone missing, to look for them, that's going to be a really important part of our whole recovery from COVID.
Thank you so much, Dr. Jan. And Dr. Chant, the question about, and which Dr. Jan had mentioned about events and activities that's happening, a lot of organizers have eased up the restrictions and guidelines. What do we need to remind organizers, and what's the New South Wales policy on that to keep events and festivals safe?
I think we're now moving into a phase of the response where we're going to be asking community organisers to work with the community that they're attracting to create events that do allow people to have participate and feel inclusive. And as Jan has indicated, some elderly people, some people that have got severe underlying health conditions may feel very vulnerable in crowded settings. So maybe thinking about, as you're organising events, can you create quiet spaces or areas away from major crowd thoroughfares where people will be happy to participate but keep themselves at a distance from others, particularly in outdoor settings. So I think the challenge for us is a different one. How do we create events that are safe enough, but it does recognise that people are going to go and attend those events who have very different risk profiles of COVID. And, you know, for many, we'll still want to avoid any risk of COVID. So how do we sort of make those events still as COVID as safe as we can, proportionately, in order to be inclusive?
Thank you, Dr. Chant. And please ask your questions on the chat. We have a question from Boshra, and her question was about cases in hospitals, and if there was a comment on that, Dr. Chant and Dr. Jan.
The hospitalisation numbers decline, and every Thursday we put out a report on how COVID has gone for the week before, the Sunday before, the week preceding that. We will continue to update the community on movements in cases. Case numbers are just one thing we look at. We'll be looking at a variety of other indicators that tell us how we're tracking as a community. But we will be communicating, particularly through that epidemiological report, what our forecasts are and how we are tracking in terms of COVID transmission in the community. But only case numbers will just be one component of that.
Thank you so much, Dr. Chant. A question about that we've received is about vaccination. Is there any chance that there will be new vaccines that people would have to take in the near future for COVID, given that there's already a lot of vaccines for other health matters?
I think what we are urging the community, and I can really understand the fatigue, you know, we've really gone out with a lot of messaging around vaccination. I think it's really key that the community does keep out and listen. There might be circumstances where we are asking people to get boosted again, but at the moment, the current settings are like, in terms of vaccination, recommendations are likely to be there for the short term, but certainly ahead of winter next year. We'll be strongly messaging around flu, and we may be messaging about the COVID vaccines. And also, it is important that the community recognises that there's a lot of vaccine development work going on. That some, you know, in usual times that takes a little bit of a time to progress through the regulatory approvals or the research that's needed to support a new vaccine. But, you know, into the future, there may well be different vaccines to choose for and different vaccine recommendations. So it's really important that we're honest that the vaccine messages will change over time, and they will be informed by what variants we're seeing, what how the variants are escaping the immunity that we've built up by both infection and vaccination, and then what are the vaccines that we need to recommend to the community.
Thank you so much. Dr. Chant, there's a question here from Sahil Makar from SBS. Dr. Chant, when do we call the pandemic over? What's the criteria as emergency response has ended?
I think it's important that the community understands that we're still watching the pandemic very closely, and for health, we are clear that the pandemic is not over. It's probably more useful to say we're moving through different phases. And, you know, the priorities for us at the moment are making sure we reduce the impacts of COVID, but that we actually make sure we're catching up on chronic disease management, making sure our other vaccinations are up to date. It's really about balancing health objectives overall, and we have much work to do. And it will be great to have ongoing conversations with the community, how we can support the community to be as healthy and well as possible. So for us, it's just about a different way of achieving the outcome, balancing different risks, but having a whole of health and wellbeing focus at the moment.
Thank you, Dr. Chant. There is a question, and I'll pass this on to Dr. Jan. Parents are concerned about the reliability of rapid antigen tests given out at schools. And what's the advice on that, Dr. Jan? We've talked about rapid antigen tests and PCR tests and reliability, and I think we just need to remind them.
Look, I think the thing that we know is that a PCR test can go positive earlier in the infection and may stay positive for quite some time after you've recovered and you're no longer infectious. The RAT tests are not perfect, but they're a good indicator of whether somebody may have COVID or not. There are times when those RAT tests don't perform as well. The key things are making sure that you read the instructions and that you actually take a reasonable sample and making sure that you process it in accordance with those instructions, because if you don't use them according to the instructions, they may not work as well. They're not perfect. If somebody is at very high risk of having COVID because they're a close contact, because they know that there are people around them with COVID, and particularly if they're immunosuppressed, particularly kids who are immunosuppressed or may have significant other illnesses, it's really important that we do make sure that they have a PCR test just to check things out, just because those RAT tests are a good indicator and the PCR tests are more definitive. But PCR tests aren't perfect. We all wish we lived in a perfect world. We don't. So I guess the key thing is making sure that we interpret those tests with the information around that particular person at the same time.
And could I just jump in there, Jess, and say the tests perform best when the person has symptoms and is most reliable. And if you get a positive RAT, you should act on that clearly. But that's why we're also urging people that if you've got symptoms and a negative RAT, still stay at home. We don't want you to spread around your other viruses, which can also do harm. And you may have COVID, so do another RAT, or as Dr. Jan has said, a PCR test. I would also urge that in the school setting, I know the schools are quite happy that other members of the household, or whilst they're distributed through schools to the children, the intent really is to support the family and the extended family have access to testing. And so I would encourage people to make use of those tests, keep a little stock holding, and have them for particularly the Christmas and New Year period, so that they've got ready access to those rapid antigen tests if anyone becomes symptomatic, or if they are visiting those high-risk settings, we're doing a RAT beforehand, even if you don't have symptoms, just gives you one added degree of reassurance. But you should never go into a hospital or an aged care facility as a visitor if you have any symptoms, even if the RAT test is negative.
Thank you, Dr. Chant. It is recommended that 3 home tests if you're exposed to COVID to boost accuracy. This could be very expensive for some communities and for those who can't afford buying that much amount. So I guess that's just a concern as well.
So I suppose there are a number of programs that are providing free RAT tests, and as I said, that's why I am encouraging you to request the RAT test for your children, or a number of there has been provision through schools. So please take up that opportunity of having a stock holding and using them. And obviously, using them when you're symptomatic will give you best guide. We're also urging that people check with their doctor about whether they are eligible for the antivirals, or the doctor would recommend the antivirals, and also whether the doctor would want them to have a PCR test. And so they can also request the doctor gives them a form should they have symptoms into the future, so they can readily get access to the PCR test as well. So my key message is talk to your doctor about what's appropriate care for you should you get symptoms into the future. Plan ahead, but also take advantage of some of those RAT access programs that are giving access to free rapid antigen tests. And please just have a little stock holding, just as you would have some masks, hopefully at home, so that you can have that no gap and good access, particularly over that Christmas, New Year period.
Thank you, Dr. Chant. Here's a question from Juanita Purcell. She's asking, when are we getting those censored face masks that can detect COVID and inform the wearers that they are infected?
I'd first want to see the evaluation of those face masks, but Dr. Jan.
I think one of the things is we're going to see a lot of innovations and a lot of really interesting technology coming our way, you know, saying, oh, we'll be able to detect COVID doing this, or we'll be able to do things like by doing that. I think the key thing will be that we make sure that we understand what the new technology is, understand where it should be implemented. And for medical devices, they get evaluated by the Therapeutic Goods Administration. So all of the rapid antigen tests, all the PCR tests, all the medicines we use are being evaluated. So we'd expect those masks to have to go through that same evaluation process so that we have a good understanding of where they would be used, how they would be used. But in the meantime, I don't think they're registered for use in Australia. So that'll be one of those things that we keep our eyes open to see where it comes from.
Thank you so much, Dr. Jan. A question from Pradeep Kumar again. How many people approximately are getting infected every day or every week with and without hospitalization?
I think it's difficult to give accurate assessment of numbers because we don't know how many people have got symptoms more broadly. I think that you look at a lot of the indicators such as hospitalisations, our wastewater surveillance, to give us an understanding of whether we're on the rise in cases or we're on that low point. As I said, the data is sort of suggesting we've really reached a low point by looking at multiple different data sets. But obviously we need to be open to tell the community, and we will, if we're seeing indicators that case numbers will rise. And as I said, because immunity wanes, both through infection and as a consequence of vaccination, both times forms of immunity wane, that's what can drive some uptick in cases as alongside new variants and the sort of behaviours that we adopt. These factors will all influence the trajectory into the future.
We can't hear you at the moment.
Sorry. Sahil Makar has asked, how would you assure members of the community that we will not catch COVID at a workplace and schools from those who are positive, as they don't have to stay at home anymore?
Okay, so I suppose this is really around saying that there have been requirements to stay at home. Mandatory registration has been occurring, but there was probably likely that many people in the community were not testing, and similarly that people weren't registering their rats, so they might have known they're positive. So in the end, this is really about working with the community and supporting the community to adopt those behaviours that we know are effective, staying at home when you've got COVID. Some of the flexible work arrangements hopefully will support people to work from home and staying at home for that period. So look, I think we all have a role to play, business, government, community leaders, in really messaging the importance of these fundamental public health approaches. And I'm confident that we have seen great leadership in working together. But these behaviours need to be sustained into the future. I mean, the thought of, the soldier-on mentality when we would go to the workplace with a cough or cold, you sort of look back and think, that's probably really not acceptable anymore. So I think we actually have changed community sentiments and community expectations, but we have to continue to embed those new behaviours.
Thank you, Dr. Chant. And then I think there are some questions about long COVID and about abnormalities that can be found with people having COVID. The question is, how many times can you have COVID, and could this have long-term effects in the quality of life or health in general?
So clearly the best thing is not to have repeated infections, and we do suggest that people take steps to protect themselves and protect others. Those steps need to be proportionate, and as I said, we're balancing health outcomes overall, mental health and well-being. The vaccines are holding up really well against severe hospitalisation and death, and it's really important that we continue to stay up to date with our vaccines. In terms of long COVID, we've still got a lot to learn about long COVID, particularly in the context of a highly vaccinated community. But we've also seen widespread transmission of the virus in the community. There's lots of work being done to look and better understand what causes some of the reported syndromes associated with long COVID, and also, importantly, develop a good knowledge of what actually works in terms of treatment and therapies. So my answer would be there's still much for us to learn about long COVID, and it's probably not just one thing. There are probably those that have persisting symptoms because they've had a really severe illness that's affected their heart and lungs, and they might have already had some pre-existing heart and lung conditions. There might be others where they're having more symptoms associated with their response of their immune system, and they might be presenting with more chronic fatigue or those sort of symptoms, excessive tiredness. So I suspect that we'll find that long COVID's got some different components in it as we unpack it and learn more. And I think what's really positive is the way that there are lots of trials going on internationally. A lot of brilliant people are trying to work and better understand long COVID and its mechanisms. So I'm optimistic that just like our knowledge base has grown so rapidly over this last period, that we'll continue to learn. But in the meantime, we know that being vaccinated does afford protection. Doing proportionate measures to avoid you getting infected is also an important component of living with COVID or being in this current environment.
Thank you, Dr. Chant.
Staying in touch with your GP is going to be really important, because your GP will be on that forefront of understanding some of the new things that are coming through for long COVID, and also will be able to keep an eye on you, because what we do know is that sometimes COVID's unmasking other health conditions like type 2 diabetes, some people's other health things that would normally have happened anyway. And so instead of writing everything off as I had COVID, I saw my GP, they couldn't do anything, it's worth staying in touch and keeping on being checked up every few weeks, just to make sure that if there is something new either emerging in your own personal health or something that's new emerging in how we can help manage you, that you've kept that relationship going with a constant person who can provide you with that care advice.
And I think, Dr. Jan, that was one of the things that we've talked about before, is making it a habit, even when you travel overseas or when you've just traveled back, and to keep in touch with your GP.
Yeah, absolutely. And I think for a lot of people who are looking at travelling overseas, as the airfares become more affordable and as the passport office comes through with our passports, people are travelling home, people are travelling to see family, people have family coming to travel to them, and just remembering that things that we've taken for granted in the past, things like hepatitis A, things like typhoid, things that you may be used to having as part of something that you grew up with, but your kids have never experienced, checking with your GP and getting some advice about whether you need to have, particular vaccines, things to avoid, because there are new diseases all around the world that may not have been as present when people lived in a particular area, things like dengue, things like chikungunya, things like Zika virus, things that are happening in different parts of the world that we haven't travelled to for the last couple of years. So worthwhile checking in to see if there are other particular things that we need to be careful of.
Thank you, Dr. Jan. A question here from Angel Montoya. Hi, Dr. Chant. Any idea how many vaccine boosters we could have in the future?
Oh, I think that's a bit of an unknown, and it's an unknown because I think we're also hopeful that we may have vaccines that are developed into the future that cover more of sort of like across the coronavirus family, give us a bit more protection across whatever variant may arise, and that they might produce more long duration immunity. So it's really difficult to answer that question with any certainty, but I would be anticipating that we will have future recommendations around vaccination in 2023. But this is a rapidly changing, environment. It's really important to just keep up to date. But we need to be honest and frank that we don't have the answers to some of those questions. It may be something we do seasonally with the flu vaccination, but at the moment we're not seeing the same once a year season that we see with the flu season generally. So we haven't got into that regular pattern where we're only got a COVID wave once a year. We're just not there yet.
Thank you so much, Dr. Chant.
I'm not saying we'll ever get what we don't. We hope that it becomes less frequent and the vaccines produce more enduring immunity. But the vaccines are very good at protecting against severe disease and hospitalisations, and it is really critical that we do keep up to date.
Thank you so much. We've run out of time, but thank you so much for joining us. I'd just like to go to Dr. Jan for any last comments, and also to Dr. Chant.
Look, I think the thing is that a lot of people are feeling really worried and anxious, and just making sure that all those things that we're doing to support people who are concerned, support people who are missing in action from our social circles, that's so important, just to look after each other into the coming weeks.
Thank you, Dr. Jan. Dr. Chant, any final words?
I suppose just to say that although the public health orders are coming to an end, we haven't fundamentally changed how the virus behaves. So all the messages around how long you're infectious for, how you transmit, who's at greatest risk, still remain the same. And we are asking the community to retain a lot of those behaviours that we've asked you to do over this previous year. And I suppose also the importance of reconnecting with your health status overall. We want to make sure that your chronic diseases are being managed well, you've caught up on your immunisations, you're caught up on your preventative health checks. It's so critical that we're really trying to optimise the health and well-being of individuals and communities overall, and COVID forms one component of that, an important component, but just one.
Thank you so much, Dr. Chant, for joining us, and Dr. Jan for being with us today. And for everyone who's joined us, we want to thank you for always joining us in these sessions. And we'll see you in the next fortnight. Our next online conference is on October 26th. Please join us then, same Zoom link and same time. Please let us know if you have any health topics you would like us to feature in this forum for your communities. The recording of this briefing will be available on the New South Wales Multicultural Health Communications Service website. We'll also send you an email shortly with the recording and the resources and some key messages and announcements that you would need to share with your community and on your broadcasts and publications. Thank you so much again for joining us. Take care, and we'll see you again next time.